Um, my name is Dr. Rumbitsa Idawa. I'm a nephrologist, which means I'm a kidney specialist, and I specialize in diseases that affect adults. So kidney disease is any damage that can occur to the kidney, and there are two major groups, acute kidney disease and chronic kidney disease. So acute kidney disease looks at diseases that are present for any time frame that is less than 3 months. And when someone is diagnosed with acute kidney disease, the expectation is that they will recover and hopefully regain normal kidney function. The other group of kidney diseases are what we know as chronic kidney disease. In these patients, they have had long-standing kidney disease, and when they have this type of kidney disease, they do not usually recover from it, and it can progress through the various stages from stage 1 to stage 5, and can even end up with kidney failure. So there are various parameters that we measure in order to classify kidney disease. One is a urine test where we check for protein. So ordinarily, in a healthy adult or a healthy person, you should not have protein in the urine. So if we find protein in the urine, it's one of the markers of kidney disease. We then quantify the amount of protein that is in the urine. Based on that, it helps us to stage the level of kidney disease. We also look at various blood markers, which again help us to calculate what we estimate as your percentage kidney function. And in line with that measure, plus whether there's protein or not, we then classify from stage 1 through to stage 5. Once you get to stage 5, by definition, it becomes kidney failure. So unfortunately, with kidney disease, it is often asymptomatic, which means there are no symptoms. Once we start getting symptoms, it's often a sign that they've already progressed to a more advanced level of kidney disease. Some of the early signs, however, may include abnormalities of urine, which is something that you can notice quite quickly at home. So if you notice an abnormal color of the urine, abnormal smell, if you see any blood in the urine, that should always concern you. If you notice that the quantity of urine that you are passing is reduced. At times, certain conditions can give you what we call flank pain. So the flank is this area of the body. That's where your kidneys are located. So in some instances, you may get pain within that area of the kidney. So the early signs are usually related to abnormalities of urine. Depending on the cause of the kidney disease, you may also notice swelling. And usually with kidney disorders, the swelling begins around the eyes. So patients who have got kidney disease may wake up in the early morning with swelling around the eyes, and gradually this swelling may progress to include the legs and even the rest of the body. Okay. So the study that we did in 2018 looked at prevalence of patients who were on dialysis. Unfortunately, we don't have accurate data which looks at chronic kidney disease per se in terms of the prevalence. But we certainly know that in terms of hospital admission, kidney disease ranks in the top 5 of the diagnoses that we see in all the patients who are admitted into our government facilities. So like I highlighted before, there are acute kidney diseases and chronic. In terms of acute kidney diseases, we can think of various examples. For example, one of the complications of infection, like malaria, is that patients can develop kidney failure as a result of malaria infection. So in that instance, we classify it under acute, because if we treat the malaria and we support the patient throughout the illness, we expect that their kidney function should recover. There are various other types of infections, urinary tract infections, which can cause an acute kidney injury. Other things that can cause acute kidney injury, For example, if someone is involved in an accident, if they lose a lot of blood, or if they have anything that can cause their blood pressure to become very low, there can be damage to the kidneys. There are also certain types of drugs or medications, I'm talking about prescribed medications, that can damage the kidney. That's why you'll often see that with medications they may say do not take for more than 7 to 10 days without consulting your doctor, or you actually need a prescription. So there are certain medications which, if they are taken for prolonged periods of time, or if they are taken incorrectly, can cause kidney injury. If we are thinking about chronic kidney disease, we are talking more about conditions like hypertension, diabetes. These are disorders that then predispose to development of kidney disease as one of their complications. So with hypertension, over time, you can develop kidney disease as a complication of long-standing hypertension. And the same with diabetes. There are other classes of kidney disease, certain types of cancer which can occur and then predispose to getting kidney disease. Other illnesses which occur in the body. For example, we have what we call autoimmune conditions like lupus, where the body is destroying particular tissues on its own. It can complicate by developing kidney disease as well. So there's a whole spectrum of types of kidney disease. So I think before they even develop the symptoms, there are certain people that we say are at higher risk of developing kidney disease. So the first thing is to look and assess to see whether you are in that group where we classify you as being at risk of developing kidney disease. So who are the people who are at risk of developing kidney disease? Patients who have a family history of kidney disease, if you have hypertension, if you have diabetes, if you are overweight or obese, and patients who maybe have underlying infections like, for example, HIV. So if you are in those risk categories, we do encourage that you get regular screening even before you develop any signs and symptoms of kidney disease. Moving on from there, once you do develop those symptoms, you then need to seek assistance from a healthcare practitioner. The initial tests will involve an assessment of your urine, an assessment of your blood tests, and also measurement of parameters like blood pressure. So we discourage people from smoking because we know that smoking can affect blood vessels, and so it can, over time, it can affect the blood vessels that supply the kidney. We also encourage moderate intake of alcohol. It can have detrimental effects on health. And like I highlighted before, in patients who are at risk, we definitely would recommend screening, at least at a yearly interval. So if you have hypertension or you're diabetic, at least your healthcare practitioner must screen for any evidence of kidney disease once a year. So when we looked at the data, but in patients who were on dialysis, we found that the average age of patients who are on dialysis were in their 50s, which is relatively young when we compare with other countries. We have a younger population of patients who have got chronic kidney disease. One of the reasons is possibly that the screening of kidney disease is lacking, and we need to be more aggressive in terms of screening for chronic kidney disease. So patients tend to present late, and at that time they're already at the point where they now require therapies like dialysis. I think like what we're doing in terms of raising awareness, we certainly want to see more emphasis being placed on kidney disease. One of the big things is that kidney disease predisposes people to developing cardiovascular disease, and we know that that is one of the problems that is becoming quite significant in terms of increasing the morbidity in our general population. So we would want to see more awareness and more information being disseminated about this condition.